I am Dr. Grace Levy-Clarke. I'm presenting on hypertension treatment on behalf of the Health Ministries at the Town and Country SDA Church in Tampa. In this section, we're going to be talking about different types of medication that we use to treat hypertension. So when we talk about medications, especially medications that we use to treat hypertension, we divide them into classes. And these classes are based on how the drugs work in your body. And the fancy name for that is the mechanism of action. It is important to understand the mechanism of action for the drug that you're on, because it will explain some of the side effects, and it will also help you manage those side effects. And again, we're going to be talking about only common side effects. We're not going to be talking about any life-threatening side effects. As always, you know, if you have a problem and you think it's life-threatening, 911. But these we're going to talk about just common side effects that you can make some changes in your lifestyle. We did, and I say thank you to the nurses, the health professionals. We did a little survey where we just asked members not to write your name, but just the blood pressure medicine you're on. And what we're doing today is we're going to focus on those medications. So we found that people were on thiazide diuretics, calcium channel blockers, angiotensin-converting enzymes, and their inhibitors and receptors. And we also had beta blockers. So we're going to talk about each of these types of medications separately now. And the first one we're going to talk about are the thiazide and the thiazide-like diuretics. I would say that this is probably the first line of treatment that the doctor will go to unless you have contraindications. We're not going to go into the contraindications today, but if you say to yourself, well, why am I not on this medicine? There's probably a reason why it was not chosen. But these are considered first-line therapies. And we put the names of some of them there that you'll recognize: chlorothiazide, chlorothalidone, and hydrochlorothiazide. And many times people refer to these as just water pills, right? So these are the classic water pills. So how do they work? What is the mechanism of action? So first of all, let's go back to part 1. Remember what we said. Your blood pressure measures the action of the heart pumping the blood through the vessels. They go to the lungs, and then they circulate, and they keep coming back. But there's one very important part of the circulatory system, and that is the kidneys. So the way how the diuretics work is they increase the amount of fluid that you lose. So in other words, increase your urine production. And by doing that, they decrease your plasma volume, and your blood pressure will just drop. So it's just a basic function. In other words, if you had 10 gallons of fluid that you had to push through a pipe, and the pipe was getting stressed, you just drop it to 8 gallons or 6 gallons. And that's going to explain some of the common side effects that you have. So the major side effects, and again, we're not going to talk about anything life-threatening, but the things that the doctor is going to monitor. Your calcium can get low, your sodium can get low, your potassium can be low, your sodium can be low, your calcium can get high, and your uric acid can get high. But I think the most common side effects that you will see from your diuretic is a hypokalemia. And that is why the doctor, sometimes if your blood pressure is so high that you have to take a high dose, they'll supplement you and you end up taking potassium because they're just unable to keep up with it. And the basic sort of just quick reasoning is when you lose urine, you lose elements. So you're basically peeing them out. And that is why what they're doing is just dropping the concentration of your blood, so it's more watery, it flows out. And that is why you have to make sure you're getting your blood tested, and your doctor will monitor you again for any changes. And the two most common one is just the hypokalemia and the hyponatremia. Most people are not going to get hyponatremic because we're eating back so much salt in our food. But you can get hypokalemic, and that is why they will supplement you sometimes with potassium. Or if they recommend, you can eat bananas, but make sure you're going under the recommendation of your physician because they know all of your medical history. All right? The next big group is the calcium channel blockers. And the two common ones is amlodipine and nifedipine. How do these work? So the mechanism of action for the calcium channel blockers is, as their name says, they block calcium from entering certain cells in the heart and the arteries. And eventually what will happen is they will decrease the ability of the vessels to constrict. So your vessels will just relax. So you have a bigger lumen, so it just flows out. And that is why we refer to the calcium channel blockers as vasodilators. And if it's a vasodilator, we'll go to the side effects now. What are some of the side effects? The common one that I think most people will find is the dizziness, the tiredness, and then you get what? A reflex increase in your pulse. So you have to keep thinking about what it is your heart is doing. So we'll go back to part 1. The blood is in your heart. Your heart has to beat or contract to pump the blood out. If you have hypertension, your heart is sensing a resistance. So it's pumping harder and more and trying to push the blood out. In order to prevent you from getting a stroke, they put you on a calcium channel blocker. What happens? The vessels relax. So now the heart feels like, oh, I need to work harder. So it will give you a reflex increase in the number of beats. So your question would be, so how is this helping me? Eventually, you're going to get to a steady state. If you find that your dizziness, your palpitations, your tiredness is just not recovering, then the doctor will look at a different class of drug. And that is why they will check you every couple of months just to make sure, because we don't want the side effects to be as bad as the disease. But as always, the most important thing is we have to protect the heart, we have to protect the brain, we have to protect the kidneys, and we have to protect the eyes. And by that I mean sometimes you're going to truly live with some side effects. There's just no medicine you're going to take that has no side effects. But the idea is you're going to look at the risk versus the benefits. And we always want the benefits to outweigh the risk. So there's going to be some minor side effect that you're going to be left with. All right, let's go to the angiotensin receptor blocker. So losartan and valsartan. How do these work? So these medications have a more specific type of mechanism that they work by. So you notice that if you go back to the first group we talked about, the water pills. So in other words, what we're trying to do with medicine is go from the simplest to the more complex. But as we understand the side effects, we've evolved to where now we're trying to give you more sophisticated medicine. So they're going to give you as much benefit and least side effects. So these chemicals, what they do is they're going to do something similar to what the calcium channel blocker is, but they're working on just specific cells. So again, what they do is they cause the blood vessels not to constrict. So constrict is small and dilate is large. So at all times, what we're trying to do is we're trying, if you have hypertension, to not get the blood vessels any smaller. The smaller the lumen of the vessel is, the harder your heart is going to work. So we're trying to do everything we can to keep the vessels dilated. But in addition to doing that, they also cause you to retain sodium. Again, it's a trade-off. So we're going to have to monitor your sodium. So when you take these angiotensin receptor blockers, your blood vessels are going to relax the same way the calcium channel blocker did. So the blood is going to move through easier through the vessels. But you're also going to be getting rid of sodium and water. So it's a little bit of a combination, and what we're trying to do is get you to the point where it's easier for the heart to work, but we're having to change some of the physiology of the body. Side effects. So you see there's some similarities with the calcium channel blocker because again, once you start to dilate the vessels, you're going to feel a bit of a fatigue because now what you have is a much bigger lumen and it's the same amount of blood that's going through it. So some people feel some degree of fatigue. You might even get just a mild headache and dizziness. But what you want to do is you want to monitor that, and your physician is going to monitor that too. Because what we find is if you're over-medicated or if the medication is just too strong for you, then you'll end up with a second disease. So instead of being hypertensive, you'll become hypotensive. And that is why you have to go back and be monitored. Because the purpose of the anti-hypertensive medicine is to make you hypotensive? No. What we're trying to do is get you normal, but for some people, they have such a small range that has to be monitored. So the only way you can go from high to normal, and you monitor low. So all of those feelings, the dizziness, the headache, it's just a hypotension until your body resets, where that volume of blood now becomes circulated at the rate that you're feeling normal. But it does take some time for that to happen.